Hello, everyone. I am Jen Rumbalski. I'm the director of the La Crosse County Health Department, and today is past the middle of June already, June 17th on a Wednesday. So welcome, and we're glad to be with you today. I will share some case updates as I usually do. So to start with, for today in La Crosse County, we currently have 19 new cases today. We have had a lot of new cases each day, as you may have noticed if you follow our postings about case numbers each day. There have been a lot of new cases coming in, and I'll share some statistics about that in a moment. In total, then, we have 171 positive cases in La Crosse County. Total negative test results are 8,344. So that is looking at total case positives to total tests completed is 2%. We have 0 hospitalized, so that's good news that the couple of folks that were in the hospital previously are no longer in the hospital. We also have 0 deaths. Our active case total right now is 106 active cases. That is 62% of our total number of positive cases. So 65 have recovered and 106 are active. In the state of Wisconsin, the total number of positives is 23,454. That is an increase today of 256. The total negative test results to date in Wisconsin are 423,736. That is an increase of 9,406. So at the state level, when we look at total tests completed so far and the number of those that were positive, that is a 5.2% positive. The hospitalizations in the state as of today are 3,128. That is total that ever needed to be hospitalized, and that went up 32 today. The total number of deaths is 712, and that went up 9 today. To compare the active caseload at the state level, the number of active cases is 5,128. That is 22% of the total cases. So you can see that La Crosse County at 62% open active cases is much higher than at the state level. A few statistics as we reviewed the data and updated our Compass Coulee COVID-19 Compass for this week, which gets updated on Wednesdays, as you know. We have gone up 607% in our cases. So from May 20th to June 2nd, we had 13 total cases that came in, total positive cases. From June 3rd to June 16th, 92. That is a very significant increase and is predominantly the reason why we have a lot of viral activity. And I came on Monday to talk about the amount of viral activity, which required us to do some public notifications. And I'll talk more about that in a moment. One of the metrics we look at is doubling time. And that means how many days does it take for us to double our caseload or our case number, the positive cases. And on June 9th, our doubling time was 26.5 days. As of today, our doubling time is 8 days. So we are not heading in the right direction. In the past 7 days, the percentage of positive tests has gone up from our total overall of 2% to 8.2% is our current percentage of positive tests in the last 7 days. So next I want to talk a little bit about the Coulee COVID-19 Compass, and I am going to pull that compass up. So you should be seeing on my screen, if you go to our website, the COVID-19compass.org, this is the website that comes up. You may have seen this before or looked at this. I have shown it before on media briefings as well. As a reminder, across the top here are the different navigation tabs to see the different data available in the compass. One of the first things that you want to look at when you get to this screen is the region. The compass defaults to our region. So if we turn this to La Crosse County, we can see that we are the same as our region at the present time. So our epidemiology status metrics have not been met, healthcare is okay, and public health status metrics are not met. I think it didn't change my. Here. So it is the same as the region. Then if we go to the navigation tabs on the top, what I think is really important, because you notice here that we have moved from orange to red as of today's compass update. This isn't surprising to us given the level of viral activity that we've had and the number of cases that have come in a short time frame. So when we toggle to this being La Crosse County, we see that our compass dial is in severe risk or red. And what this means is that then you will reference the severe risk column in the recommendation tables in order to advise yourself about what actions you should take to protect yourself, your family, and your community. So for example, we always want to stay home if we have any symptoms. So that stays the same across the board. If we look at leisure travel outside of La Crosse County, really, there's no leisure travel that is recommended at this time. So after any leisure travel, the recommendation is that there would be a 14-day quarantine. Physical distancing and fabric face coverings while in public, the recommendation in the red severe risk column is to stay home unless you must go out. And then if you must go out, you should be physically distancing, and you should be wearing fabric face coverings. Attending social gatherings, different than in category orange high risk, where we had up to 15 indoors with the fabric face coverings and physical distance. We really should not have any gatherings outside of the household in this red category. Similarly with outdoors, where we previously had 50 or fewer people with recommending the face covering or physical distance, the recommendation right now in our area, in our county, is 10 or fewer with fabric face coverings and physical distance if outside. If you're visiting a restaurant or bar, again, inside versus outside, it really should just be takeout and curbside pickup. I will just note here that we do not have the ability to close down establishments. We do not have the authority to do that. So this really is supply and demand, that you have to make good choices about what you do. And if you're going to go to a restaurant or bar or any other location in our community, including grocery stores, getting your hair done, anything in the community, there's going to be risk present. And it is really important for you to decrease travel wherever possible. Protecting yourself in the workplace, the recommendation is working from home whenever possible. If you must be in the workplace, then physical distance and wearing the fabric face covering is recommended at all times. I think where we say this may not be necessary is if you're in your own office space with walls and a ceiling and a door, then you are not in close contact with others. But any other space, including conference rooms, hallways, any communal locations, this is the recommendation. And really, attending personal care services at this time in red stage are not recommended. If you scroll down, do remember, and I won't go through this in detail, but there is also a recommendations table for businesses and establishments. And so this is a good location for businesses and establishments to look to see what their recommendations are based upon the current data that tells us what our risk levels are for COVID-19 in our community. And as always, you can toggle through any of these other navigation tabs at the top to learn more about epidemiology status, healthcare status, public health status. So as we know, we have turned to red. The predominant reasons are the number of cases, the time in which those cases have increased, and the percentage by which they have increased, as well as the public health status. And that public health status tab, I'll just show you here. So this is the region, and I will look to La Crosse County. So what we're seeing here is that there have been cases that public health cannot reach within 24 hours and also within 48 hours. So this metric is about trying to reach 85% of the contacts to cases within this 48-hour time period. And I want to note here that this should not reflect on the lack of really good work that health department folks are doing for us and this community. This has a lot to do with the number of cases that are coming in, the number of contacts those cases have, and the ability to reach those folks within this designated time frame. So if we leave messages and we don't get a phone call back, or someone will not speak to us, or we can't reach them for whatever reason, we mark that here as we were not able to reach, and we look at each case and we tally the data relating to each case. You will also see here that the cases being able to be reached by public health, these are the cases, and these are concerning. Being able to be reached within 24 hours of the test result is in yellow stage. So please use the Cooley COVID-19 Compass as a reference for you, and I would encourage you to take that seriously. I realize that it is very difficult to look at some of those recommendations and to follow those. But again, I think that the case numbers, the speed in which those cases have been growing and increasing, we had 21 cases yesterday, 19 today. There is no indication that the cases will slow down unless we take the precautions that are being recommended. Next, I want to talk a little bit about outbreaks and notifications. So I want to help you understand what an outbreak really is. So the term outbreak is something we use to express that a certain facility has a certain number of cases in that facility. This is not a term that's new to COVID-19. We use this term with any communicable disease. And the outbreak term can vary with numbers of cases depending upon the type of facility, because there is a risk level involved in it. So you can find all of this on the Department of Health Services website under facility-wide public health investigations. And on that site, it says that a single confirmed case in a long-term care facility will initiate a facility-wide public health investigation. That is another way of saying that we consider this to be an outbreak in that location. So I want to say that the term outbreak does not need to be negative. It is just a term that we use in communicable disease investigations to identify that we need to be working with that facility very closely to assure that spread does not occur. So long-term care facilities here include skilled nursing facilities, including nursing homes, and assisted living facilities, community-based residential facilities, which are sometimes called CBRFs, and residential care apartment complexes. So that is a single case for a long-term care facility. The other facilities are two cases. So two or more confirmed cases in the following settings will initiate a facility-wide public health investigation. Group home facilities, including correctional facilities, homeless shelters, dormitories, and group homes. Healthcare facilities, including hospitals, clinics, dialysis centers, hospice, and in-home care. Workplace, non-healthcare settings, including manufacturing and production facilities, distribution facilities, offices, and other indoor workplaces. And finally, other settings, which is the catch-all category, including adult or child daycare centers, restaurants, event spaces, and religious settings. So essentially, an outbreak just means that based upon the number of cases in that facility, we need to conduct a facility-wide investigation. So that is an important distinction from public notification. And just so you know, we will be putting a new page on our website, the lacrossecounty.org/COVID-19 website. You will see a new page or a tab on the left side of that website that will say notifications and outbreaks. And that tab will really show you then what facilities are considered to be in an outbreak status, as well as our public notification process. And what we have and what you'll see, it's not yet loaded on there. We're working with our technology partners to get that up on the website. So be patient with us as we work to get that done. But we have a flow chart. And again, as we have been all along, we want to be very transparent. We want you to know when and why we make a public notification and what that public notification means. So I'm going to explain that here today, and then know that this information will be posted on our website as I indicated. So when we look at making a public notification, what we look at is there one or more cases that were in a certain establishment at a given time? And if that is the case, then we ask, did any of those cases have what we call an aerosolizing activity? So this is where the droplets can be spread more than 6 feet, which makes us very concerned. So that can be if there was singing, if the person was actively coughing or sneezing, or if there was physical activity or exertion in that place, in that location, especially if that is within 6 feet of another person by whom we cannot identify or name. If that is the case, that would be considered a high risk and would deem public notification. If that is not the case, then we move along in the flow chart and we ask, is the case or are the cases staff members at a facility where direct contact with multiple patrons or visitors, or they are highly mobile throughout the facility? If the answer to that is yes, so let's say if it's a restaurant or an establishment that has waitress staff or waiter staff or bartenders, if there are 2 individuals that have been in the location and are staff members and move throughout the facility and have contact with multiple people in that facility, that would be deemed a high risk and would result in a public notification. If the answer to that question is no, the next question is there more than one case that's linked to this facility that are not otherwise related, such as from the same household or party? If the answer to that question is yes, that also goes to high risk public notification. If not, then what we're looking for is the amount of time that those cases were in the establishment, because the way the virus spreads and is moved from person to person is again by droplets, close contact within 6 feet, and we're really looking for time of exposure. So what we're doing here is we're summing up the amount of time that the individuals were in the establishment. If that is not at least 15 minutes, then that is considered low risk. If it is 15 minutes or more, then we're asking if any of them were within 6 feet, namely a close contact, which is defined as being within 6 feet for at least that 15 minutes. And if the answer to that is yes, then we move to the next question, which is, did any of those individuals have a fabric face covering or mask on at all times while in the establishment? If the answer is no, then we move towards the next question, which is, can we not identify any of those individuals that they were in close contact with, especially looking at if any of those individuals might have been known to be at high risk, such as those that are immunocompromised. So what we're getting at here is, let's say that there was a meeting and it was within a facility that was with all individuals who were immunocompromised, or a meeting of an organization that was with folks that had rheumatoid arthritis or something like that. So if that is the case, then that moves to yes, and it is a high risk public notification. If not, or if the individuals were wearing a fabric face covering, that is considered medium risk. Anything in the medium or low risk category does not require public notification. Those, however, I will say, we are going to be putting a list of establishments that fall into high, medium, and low risk on our website. So you can see any facility that a case has been in and identified through the investigation process as the disease investigators talk with those folks. Those facilities will be listed under the low, medium, and high risk categories. And they will be listed there until 14 days from the date of the exposure event. Then their name will come off the list. The purpose of that, again, is to be transparent in helping our community members understand where the risk levels are. That is not a fail-proof system or a fail-safe system. So understand that even if a site is not listed, doesn't mean there's zero risk there. It just means we don't have an identified case that has been in that facility. So we have said all along, there is risk anywhere you go when you leave your household. The viral activity is increasing in our community and will continue to increase until we do all of the precautions that we are being asked to do, especially staying home if we're sick with any minor symptoms, wearing a fabric face covering, and physical distancing when out of your home, when you're at your workplace, when you're grocery shopping, when you're getting essential items, whatever it is you're doing in the community. So just to reiterate, the only time we make public notifications is when we have a high risk situation. And again, that flow chart defining what we look for high risk, medium risk, and low risk will be posted on our website as soon as we can get it up there. There also is a section for business recommendations on the flow chart. So if there is a case involved with a business, we want to let that business know that that has happened. Oftentimes, the individual, if they work at that place of business, may have already contacted the business and told them that. Sometimes, though, it's a patron and the business would not be aware. And we want them to know that that happened in their place of business. So we will tell them that. We also talk through recommendations and guidelines, find out what they're doing and what they might be able to improve upon to protect their employees and the public that they serve. Then we will let them know about this grid and that their place of business will be listed underneath the appropriate category based upon the flow chart. There also have been a lot of questions about why certain businesses close for 2 days or 14 days. So I would like to clear that up. We recommend that businesses close for deep cleaning. Oftentimes that takes 1 to 2 days. We do not routinely recommend closing for a longer period of time. That doesn't mean we can't recommend that. It just means it isn't the normal, and it would be very specific to the situation at hand. Some businesses choose to close longer, and that is not always at the recommendation of the health department. I think that's a good choice if they would like to do that, but that is the business's choice if they wish to close longer. They also will oftentimes make notice to the public prior to the health department making notice, and that's okay too. I think transparency is important, and it really helps the public understand a little bit more about risk. But again, I reiterate, risk is everywhere in the community at this point, not just at those locations that might be listed on the website. So we have been getting a lot of calls and a lot of emails to our COVID-19 line, our call center line, and our main health department line. I think I want to make sure that our community understands that our primary goal is to prevent cases and ultimately decrease the spread of COVID-19 in our community. So in order to prevent those cases and the spread and provide the best possible customer service, we may need to make some adjustments to include adding perhaps a call tree to our phone line in order to help direct folks to where they need to go and just provide some triage to those calls. I do think, though, I would like to share some general guidance that we receive relating to a lot of various questions. So they can be kind of themed into 3 general areas that I want to share as far as guidance. If you have been diagnosed with COVID-19 and it is lab confirmed, please stay home. You are considered to be in either isolation or quarantine, depending upon if you have symptoms. We do not want you to be out and about, out of your home, even exposing others in your household, because you are in a state where you could spread the virus to others. You should stay home for 14 days from the date that symptoms began, or if you have no symptoms, from the date that the test was completed. You do not need to have symptoms to be able to spread COVID-19. Number 2, if you were exposed or you were notified of an exposure event, please stay home in quarantine and monitor yourself for symptoms for 14 days from the date of the exposure. If during those 14 days you develop any of the symptoms, so that again is fever or chills, cough, tiredness, muscle or body aches, a headache, new loss of taste or smell, a sore throat, congestion or a runny nose, nausea, vomiting, or diarrhea. Any of those symptoms, even if mild, we ask that you contact your healthcare provider, as you may need to be tested. If you encounter difficulty getting tested, sometimes that can be a challenge. There are criteria in our healthcare sites to try to maintain the supplies of testing. So if that happens, then we would ask that you call us at the health department so that we can figure out if you need to be tested and can get you tested. Please know that you must stay home the entire 14 days, even if you get a negative test result. And that is because the viral load at whatever time you get that test may not be high enough to make the test turn positive, and you still might be able to spread COVID-19. So if you've been exposed, you should stay home. And if you have symptoms, then we ask you to get tested if you have symptoms and an exposure, especially if it's a close contact. Third, if you have symptoms of COVID-19, again, all of those that I previously listed, contact your healthcare provider to determine if you need to be tested. If those symptoms are severe, such as difficulty breathing, chest pain or chest pressure, or a loss of speech or movement, please hang up. If you call us, we're going to tell you to hang up and dial 911. That is the time when you should activate emergency response and have someone come to your home. When you call them, let them know that you are having symptoms and if you think you have been exposed to COVID-19. If you encounter difficulty in getting tested, again, that's a time when you should call the health department. So I do also want to say that based upon us trying to triage these calls, the volume of calls and emails that are currently coming to our department, and we're grateful for those, but we have to make sure that we're prioritizing the cases, the contacts, and those that need advice or guidance about what to do. And again, if you've been exposed, this is what you need to do. You need to stay home. If you are a case, you need to stay home. So we want you to know that we're going to get all of your responses. We're going to look at all of them and read all of them. We're going to prioritize them, and we commit to receiving all of those, prioritizing them, and responding to as many as possible, as quickly as possible. So I just want to say it may be that the topic of the call or email does not get prioritized, and we only have so many individuals who work at the health department who can respond to these calls and emails. So I just want you to know it isn't that we don't care about those, and it isn't that we're not receiving them and looking at them. We are. We just have to prioritize and make sure that we're focusing on the goal at hand, which is to protect our public from COVID-19 and the potentially serious health effects that can cause. And that is really by focusing in on cases and contacts to cases. So with that said, based upon those statements, if there is a reason for you to call the health department, we want you to call the health department. If there is a reason for you to call EMS, medical services, of course, then you need to do that. We would ask that you call our call center line and not our main health department line if possible, so that we can keep that line free for non-COVID related health department activities. And just to reiterate, the call center number is 608-785-6240. 785-6240. We also are trying to have as much information as possible so that you can get the information you need, perhaps without needing to talk to someone, on our website. And that is lacrossecounty.org/COVID-19. And of course, the recommendation table is also a resource for you on the Cooley COVID-19 Compass. And that web address is covid19compass.org. With that, I will take questions from the media.
Hi, Jen. Marcus from News 19. So right now, where's the biggest chance of COVID-19 spread in La Crosse County?
Well, Marcus, right now, the biggest chance of COVID-19 spread is very wide. That net has gotten very large. So we have, as you know, the 7 establishments that were released on Monday. And I forgot to say that we need to add a date. So I apologize for not having this in my notes to read. We know that there was also an exposure, and we'll put information out about this after this media briefing, at Blue Moon on June 10th. So previously the dates were for all of those 7, June 5th to the 7th. June 10th is a new date that we have to make a notification about, specifically relating to Blue Moon. So as far as where this is in our community, we've seen it at a number of establishments. The list is pretty long as to where at least one case has been in our community. Again, during the infectious period. So the infectious period is, we look 2 days before symptoms begin. And if there are no symptoms, it's 2 days before the date of the test. That is the beginning of the infectious period until 14 days from the date of symptoms beginning or the date of the test. So we have seen a lot of individuals during their infectious period in a lot of locations across a lot of sectors. And once you see the full list, you will see that the answer to your question really is that if you leave your household, you should expect that you are being exposed potentially to COVID-19, which is why I just continue to ask our public to please physical distance, wear your face covering, do not go out if you have any minor symptoms. If you've been exposed, do not go out. And in general, try to limit your activity and your travel and your movement right now, because there is a lot of spread happening and it is an exponential process. One person can transmit this virus to many, many people. So, and people are very mobile in our community. So I think the answer to your question, which is always longer, I feel like than maybe it should be, sorry, Marcus, is that it's really all over in our community right now.
So is there a specific bars or beaches answer that you can give me?
So again, the list of 7 were worthy of the public notification announcement. We are also going to put out a list of those that are technically considered outbreaks right now. So there are 4 long-term care facilities on that list. And then there are 4 other non-long-term care facilities. And the reason why I'm not stating those right now is because we are making sure that those businesses know that they're going to be on the list out of courtesy. And then we have a spreadsheet where we put all of the information that is connected to our disease surveillance system. And anytime an establishment is identified through a disease investigation with a disease investigator talking to the confirmed case, we put that on the list, and based upon that investigation, we determine what risk level it is. So it will show up under low, medium, or high risk. And again, anything that's in the high risk category will result in a public notification.
Hi, this is Hope with Wisconsin Public Radio. I have two questions for you. First, I wonder if the current spike in spread that we're seeing among 20-somethings in the community, which often overlap with students in our community, are you concerned with UWL's, Viterbo's, Western Technical College's plans to have students return to campus in the fall?
Thanks, Hope. We have been in close contact with individuals at UWL, and they're actively working right now on their plans for the fall. I know that they want to have individuals back on campus. They have been planning for us to be in the yellow category, and in terms of risk level, I have encouraged them to consider more likely that we would be in orange, hopefully not red, though that isn't impossible. And I do think that it's concerning that we will have spread, but we already have a lot of individuals who attend college in our community. And part of this is going to be how to figure out the balance between educational needs and health needs and other needs, frankly. And I can say that we are working closely with UWL and other campuses to advise them about the risk levels and to give them the information that they need to make the best choice that they can for their institution.
And just quickly, the second part of my question, I wonder if you have been in contact with public health officials in other communities that have similar universities, and if they are seeing, I guess, similar spikes in cases among potentially student populations.
Yeah, thanks, Hope. That's a very good question. And I am in contact with some health officers and health departments that have universities. Of the ones that I am in contact with, I have not heard that they're having the same type of spike, but that doesn't mean it isn't happening, because I'm certainly not closely in touch with all of them in the state that may have universities in their county. So, but I can tell you, I have not heard that same trend or pattern.
Go ahead, Marcus.
Sorry, Jen. So I wanted to clarify. So when you mentioned the long-term care facilities, when you answered my question, did you say that they were under investigation, or how are they included in your guys' new list?
Yeah, so the long-term care facilities, if you remember, and I just want to be cautious. I know the term outbreak can be scary. It is not a scary term. Outbreak by definition for a long-term care facility is one case. It only takes one case. And that is really because I think we recognize that we want to be closely connected to long-term care facilities, which we have all along from the very beginning of COVID-19. We've been very connected to those facilities to help them be very prepared. And you heard last week from some members of a task force. Ultimately, one case though, because those facilities have such a high risk of spread and of death, because those individuals in those facilities are a vulnerable population. So one case, and so what I'm saying is that there are four long-term care facilities / assisted living facilities who have had at least one case. And that means that we're in close contact with those facilities to make sure that they're taking all precautions necessary. And they really are. I've been really proud of our long-term care facilities. They're very careful. And I think, just as anybody, there is a risk with, viral activity in the community. Just with any workplace, their employees live in the community and need to get items in the community and can be exposed. So I think, it really is about the precautions they're taking. They are testing, they are wearing personal protective equipment, they are closing off sections in order to make sure that spread does not occur. They're doing a very good job, very, very cautious to make sure that there is not quick spread that can happen. We've seen that happen in other communities around us. And we do not want to see that happen in La Crosse County in one of our facilities. So to answer your question specifically, the outbreak piece is defined as one case in one of those facilities, and we have 4 sites in our county right now that would meet that definition. And those will be listed on the website under the outbreaks section. And those facilities actually also, to note, are already listed on the Department of Health Services website. That website lists out any long-term care or assisted living facility that has met that definition.
And so when do you think your guys' list will be updated?
So we're working on it right now, and we again, it's sort of a technology IT piece. They are working as quickly as they can to add that page to our website, and we will get that up as soon as possible.
Hey, Jen, Caitlin with Wisdom News. On Monday, you had mentioned that there was just one individual who had tested positive, who had been linked to attending protests in the area. Has that number grown at all?
So I will say that with the number of cases that have come in the last 2 days, so I think 21 yesterday, 19 today, we have had to send some of those cases to the state in a surge plan. That's part of the process, is to make sure that in a surge situation with that many cases, that we can reach those cases in a timely fashion. They are filling out information on the electronic disease surveillance system, but because of how many cases there are, the amount of data that is there takes a little longer for us to sort through. But I have not heard that that has changed, Caitlin. I only knew of one individual, and the investigators are asking that question.
Thank you.
Hi, Jen. This is Olivia with the Tribune. I'm wondering if you guys have had a lot of responses to the online form for those who visited those 7 locations that weekend.
Yeah, thanks, Olivia. We did have a lot of responses. I think that the number was somewhere around 537. All of those individuals, I personally sent an email through our COVID-19 email address to those individuals to provide them information about what they need to do, to include if they have symptoms since being exposed. There is a form that they can complete that will assist in getting them tested at local facilities and would help basically become a referral to those facilities. So it's, I really give kudos to my team for coming up with that process. It's pretty slick. And I think it helps us make sure that we can quickly communicate with those individuals who may have been exposed. And I am grateful that any individual who felt they might have been exposed connects with us, lets us know through that Google form if they had symptoms or not, and then we can respond to them and let them know what the instructions are.
Jen, we're getting a lot of questions on Facebook today of why we are not planning a local order and why some counties have them and we do not.
Yeah, thanks. Thanks for those on Facebook. This is a tough question. And one I struggle to answer, but ultimately it comes down to there is discrepancy across the state with regards to what authority health officers really have. And while some have chosen to take that action, many have not. And that is because, again, in the Safer at Home order, when the Supreme Court overturned that order, they identified specifically the statute that provides authority to health officers. I think it was specific to the state health officer authority, but it's very close to the local health officer authority. And it basically has led to a lot of conflict and discrepancy about what that authority really is. And we believe that we do not have the authority to write a health order at that level. We can write a health order if it is looking at a specific location. Perhaps they have not taken our recommendations, they continue to not protect the public, and maybe exposures have happened there and they happen again. We can write an order in some of those situations on a case-by-case basis. And then ultimately it's up to the health department to enforce that order. It would not be something that is enforceable by law enforcement. So I just want to say that even if we took that action, which is limited power, and that I never take that for granted, just so you know, I'm very cautious about the use of that, but will do it if it's necessary and appropriate. Then we basically can write a letter, an order to that facility. We would ask them or tell them what they do or do not need to do, what actions they should be taking or not taking. And if that is not followed, essentially our ability there is to write them a citation, which is a fine essentially, or we could take that case to court. It is not the type of scenario where if they don't follow the order, so let's just say someone's going to have a mass gathering and we're currently in red. If somebody decided to do that, we can write an order to say, you cannot be doing that right now. The level of viral activity is too high. And unfortunately, we can't bring law enforcement in to actually stop the event. So it is challenging to use that authority in the right way when it's absolutely necessary. So I just want individuals in our community to understand, it's not like I am making a choice to not protect our public. I think it's pretty clear that we're doing everything we can to protect our public. And a lot of that action comes in the way of primary prevention, which is preventing cases, and secondary prevention, which is preventing spread from a case. And it has a lot to do with our public helping us with that, including our businesses, all of the individuals who live here, taking seriously those recommendations. We have very few tools at our disposal to be able to stop the spread of COVID-19. And if we are not using all of those tools, specifically staying home when you're sick, staying home when we're in red phase, when you have to go out wearing a face covering, I can't stress that enough. It will protect others if we are all doing that. We have to make that the norm. And then keeping our distance from others that are outside of our household. We know how this virus spreads. It spreads from person to person by droplets that come out of the mouth or nose, especially when symptomatic with sneezing or coughing, but not only in that way. We've seen a lot of spread with individuals who are very minorly ill or don't have symptoms at all, and they are able to spread it to others. So we have to take that seriously. And I would just indicate that that is probably the most power that our community has to stop the spread, is for all of us to follow those recommendations and do those simple asks as often as is possible.
Marcus with News 19 again. Jen, do you think you could show us on your computer where that list will be updated?
Oh, sure.
Thank you.
Okay, let me. So you can see here, this is the website, lacrossecounty.org/COVID-19. When you are on this site, you'll see, I think you will see it pop up right below the Cooley COVID-19 compass. It will be a page on this site between Cooley COVID-19 compass and national info. It will say something like outbreaks and notifications, or notifications and outbreaks. As soon as they have that loaded, that's where you should see it.
Hi, Hope with WPR again. I'm just curious if you've spoken with the local Tavern League or other business organizations about the just the number of businesses that have been associated with risk.
So Hope, we do have a section of our department that has that really their job is to be in close contact with the businesses in particular that have had a positive case. To this point, our focus has been, because of the mass number of lifts that we have to do right now with cases, contacts, and business connections, as well as all of the calls and emails coming in from the community. Their job is to connect with the business and to work with that business to understand what they're currently doing, how they can improve, and for them to be aware as a business that they have had a positive case in their establishment. To this point, we have not had the opportunity, though we would welcome that, to have conversations with business groups, Tavern League, others, whoever is necessary and wants to really try to work to prevent the spread of COVID-19. I think that makes a lot of sense to do that in a larger group, sort of a larger population type setting. But again, our focus has been on making sure those businesses that have had a case understand that and can make improvements. And then, as indicated, are closing for deep cleaning if that is recommended. So those have been the primary areas of focus for us.
Hi, Jen. This is Olivia with the Tribune again. I'm wondering if you have demographics to share on the new 19 cases from today.
That's a great question. I don't believe that those cases have been fully inputted yet. Again, we are sending those cases to the state, and the state is working on those cases. So it may take a day or two before we will have more information on them. Just the total number that are coming in at any given time. I know that our team has focused on the connections with those cases and contacts. Again, our team is full with cases through yesterday. They took the first 5, and then we needed to send the remaining 16 to the state. So we are working closely to try to get those cases connected with. And I think because of that, I don't have that list for you today. We try really hard to have that ready in terms of the age groupings and the severity of symptoms and the gender of the individual. But I apologize, I do not have that for you today on the 19 cases that have come in so far.
So before that list gets updated on your guys' website, do you think if people want to know sooner what the list of establishments and places are, it will get posted on your guys' social media?
As far as the businesses, Marcus?
Yeah, and the outbreak part.
Yep. So again, as soon as we can assure that, and all of the businesses that we did public notification on Monday are aware. So those are out there. There are a couple of businesses that we were working on contacting to be able to let them know that they were going to be listed under the outbreak section. So as soon as that information has been connected to the business out of courtesy, as soon as that happens, yes, we can put that on social media. And then the other businesses, again, that list will be fairly lengthy, and we will be working on putting that in. But as soon as the page is up, we'll be adding information to it as we are able to.
Jen, we have a question from,
Yeah, I was just going to say, and I think that, again, while I know that individuals in our community want a list of names, please know that the list of names does not indicate the only locations where the risk is. And there are a lot of locations. It really is all over our community, and we need to be comfortable with recognizing that there's going to be risk if we go out of our household. Nicole?
Yep, we have a question from WKBT. When would we say is the right time for beaches to reopen?
So to my knowledge, the beaches were closed by the city of La Crosse, and as with any business or location or establishment, we will pull the name off of that list. Same thing with the beaches if they are associated with a case once it's been 14 days from the last known connection to that location. So they will stay on there longer if there are additional cases that have been there. And again, if it warrants public notification, we will do that as well.
And Jen, we just have one more question from Facebook is what is the criteria for sending a case to the state versus keeping it in-house with our own team?
Well, you know, I struggle with the fact that we had to send any cases to the state. Not that they can't do a great job, but the value of having those cases locally is such that we don't want to do that. But again, we've moved almost all of our contact tracers into disease investigation, and those folks are doing as many cases as they can put on their plates. And with this many cases coming in, many counties would not be able to handle this many cases at one time. How quickly they've come in, the number of contacts they've had, 21 and then 19 in consecutive days, 92 cases in a 2-week period, just necessitates that we have to send some of those cases to have the state investigators. They're trained the same way as our staff are. It's just that they're not local. So again, we try to keep those local as long as we can, and we'll go back to having them be local as soon as possible. It's just that the sheer volume of those cases and the number of open active cases, because of how quickly they've come through, just means that we have maxed our capacity. And if we're going to continue to decrease the risk, we've got to make sure that someone can connect with them in 24 hours in order to get the information from that case about where they've been, where the exposures are, who might have been in contact with them, so we can reach the contacts. And that's a critical aspect to decreasing spread in our community.
When you mentioned earlier, La Crosse County's open cases at 62% higher than the whole state, what does that 62% mean for people here?
Yeah, so Marcus, what I said there was that out of our total number of cases, which is 171, we have 106 active open cases. That is 62% of the total positive cases. So 65 have recovered, and 106 are currently active and open. The state's active and open case number is 5,128. And of the total positive cases, that is a 22% active open case number, whereas ours is 62%. So ours is 40% higher than the state's at this point.
One more question from WKBT. Is us staying in the severe risk category going to be long-term?
I think that depends upon what our community does. We are doing everything that we can to stop the spread of COVID-19. We cannot change choices other than educating and recommending and asking for you all to decrease the amount that you're traveling and moving around, to make sure that you are following guidelines and physical distancing and wearing fabric face coverings. When and if those things are happening widespread in our community, we will see case numbers go down.
The DHS has 6 open investigations in La Crosse County, with 1 being a long-term care. So just wondering if is that information just outdated or slower?
It might be, Marcus. Yeah, because we have 4 long-term care and we only have 4 non-long-term care. So we'll take a look at that. But we've seen that happen before, where the state's numbers can be off by ours a little bit. Which I think is partly why we want to be as transparent as possible, and it makes sense for us to be your local source for information, as we know the information better and more closely than the state does. So yep, we'll make sure that that our website gives you the accurate information, and we'll send a message to the state to see if we can sync that up.
Any other questions for Jen today? Not seeing any. Thanks, guys.
Well, I'll just say as I close that though this is kind of somber in terms of the number of cases, I do want to just put a little energy into the fact that I know we can do this. I know we can do better. I know that we can make choices to always wear fabric face coverings and always physical distance. And we can change this outcome that we are currently seeing. So don't be discouraged that we are in red. If we take this seriously as a community all together, not just individuals, then we will see these numbers go down. And we are working as hard as we can to do our part in that. And we ask you to join us in that fight and do as much as you can as well. And just want to close with a thank you to those that are doing those things already, have been doing them, continue doing that. You're doing the right thing, and we all can improve. So now is the time. If you haven't made these behavior changes, now is the time, and we can do this together, and we can make this impact turn around and be different in La Crosse County. So thank you so much, and have a good rest of your week.